Hi, this is Dr. Hanson. In this episode, we're talking about staffing considerations that when you're starting a medical practice, a solo medical practice, what other kind of staff do you need? Well, this may sound weird to some people, but at first you don't need any staff. If you're starting with a relatively low patient load, it's not that complicated. For example, a patient comes to the waiting room, you tell them hi, and you bring them back from the waiting room, and you can weigh them yourself and put them in a room and start the visit. So it's having staff is not necessary. Now, if you're coming from an academic center or a big box employee type system, you probably had some LPNs and RNs and medical assistants working with you, etc. Somebody that could do EKGs and give shots and stuff like that. But you can do all that yourself. I mean, you could run your own EKGs, you can give your own injections, you can do a lot of different things yourself that you don't need an assistant for. And actually, patients would appreciate that. So you do not need to feel that you have to have staff when you're getting started. However, if let's say you get a little bit busier and now you want maybe you want a staff person. So what kind of qualifications you're looking for? You are going to look for qualifications of somebody that you think is able to handle multiple tasks, somebody who smiles, and somebody who has a good attitude and is willing to learn. So you're going to mold this person into what you would like them to be. No matter what, you don't want a grumpy, foul person. That's going to be so hard to change, and it's going to be like acid on your practice. You may just want to have a clerical person help you. In other words, somebody to answer the phones while you're busy seeing patients, and they can take messages or forward messages to an EHR. So you are actually going to probably look for more of a clerical person as opposed to an MA, RN, LPN, that kind of thing. So staffing is going to be very simple. Now, the difference would be is if you're an insurance-based practice, somebody's got to do the billing and collecting. Somebody is going to have to reconcile that. Now, a lot of times electronic health records have their own billing systems within it, and that will generate bills from that, send claims up to the insurance company. However, you have to be careful about that in the sense that it's not completely hands-off. It will typically require some other human in your office to be working on that. Now, it could be you, the physician. Again, as an early startup, you're able to handle that claims process and billing process. So I would not, when you're starting your medical practice, I would think about going with no staff. If you have to get some staff, get a friend or somebody who can at least work part-time to simply handle some of the documentary chore aspects of it. In other words, you don't need somebody there full-time. As your practice grows, then you're going to probably want to add a clerical to do phone answering and to do greeting, etc. And then again, if you're doing an insurance-based practice, you're going to want somebody that is a bit adept at billing, which can be a little more complicated to find, but you can ease them into that. There are more details in our document that accompanies the video, but those are some kind of basic things to look for in staffing a practice. And the main point is that when you're just getting started and you have a minimal patient load, you really don't need anybody. And that's a good way to save overhead. All right, thank you for listening.